As part of ISO MVR CanCon 2024, we have two distinguished guests with us. We have Dr. Masato Fujiki, who's the director of Intestinal Transplant, Cleveland Clinic, USA, and Dr. Michael Valente, associate professor surgery at Cleveland Clinic, Lerner College of Medicine at Case Western Reserve University. Welcome to you both.
Thank you.
Thank you.
First question is to Dr. Fujiki. So do you think that transplant oncology is an exciting new branch in oncology?
Yeah, indeed. So this is a very new concept that transplant oncology we need to work together, and the mainly the idea is originated from the hepatobiliary surgeon who came up with the idea and tried to use liver transplantation as a most radical way to achieve the R0 surgery. But nowadays, our field, intestine transplant field, is also trying to gain same goal, and it's very exciting.
So the questions which it will crop up in every doctor's and patient's mind would be the fact that bigger the surgery, the bigger the chance of recurrence and bigger the chance of failure because you have more extensive disease. So is that always correct?
So I think like other medical field, the patient selection is very important. So I think you have the good outcome with the selected patient, not to go like a crazy case. And if you see good outcome and start with very slow step, and you will see the good result, and that good result can push the field more. That's how I think we not it's just we are just starting this journey. So not on in the India or anywhere else in the even in the United States and the European big centers, we try to do with small steps.
Yes, sir. Towards Dr. Michael Valente. So do you think that organ availability will be an issue because cancer is always associated with a negative outcome in the public domain? So it will always be prioritized last in certain situations. So do you think that organ availability is going to be a problem?
I think in the world of intestinal transplant, that is not a problem. There's a wide availability of small intestines. Liver, on the other hand, is a little bit more difficult. And actually, Dr. Fujiki may know a little bit more about the liver portion for transplant for cancer. I know it's not as simple and straightforward, more difficult to get.
Yeah, exactly. So liver transplant is still there's a lot of the death of the patient who is waiting for the liver. So there's a very strong competition. So you really have to have the perfect outcome after liver transplantation to get the organs. So I think you are wondering about how the outcome of the using transplant for the neoplasm cancer, which the recurrence is going to be the issue. So again, by huge data set we have done already for the other cancer type. So we will try to titrate which patient can have like a favorable outcome that can justify the use of the liver. It's always an issue of organ scare the availability of organ.
Scarcity.
Scarcity, yeah. It's anywhere in the world. And you're going to have different problem in each area. So UK experience and United States experience are different. And I think India and the rest of the world are different.
Yes. So if you look at India and especially Southeast Asia, where there is a lot of resource limitations in certain parts of India, so how do you think that we should, as a country, move forward in the field of transplant oncology in India, specifically in India? Any of you can take the question. It's more of a philosophical or probably the direction which we should take.
No, and I think the field in itself is in infancy and just starting, as Dr. Fujiki said, taking small steps, but not every center in the United States is performing these or doing these. So I think centralization, centers of excellence, if you will, or high volume facilities that have the resources and the capabilities that's where it's probably going to be. It's not going to be something that every institution or oncology department can be offering, in my opinion. Dr. Fujiki?
So the last question which I would like to ask you is, what is your message to any young surgeon who would like to take up this field of transplant oncology? Because it's exciting to hear and exciting to dream about transplant oncology, but what is the ground reality when a young surgeon is deciding to be a transplant oncologist?
Yeah, good question. So we are very thrilled to be here, and we had a lot of attention. It's very, I think your country has a bright future, having like a young generation who is really willing to learn from the speakers. The the interesting part is that transplant surgery was kind of like a high level class, surgical category like 2 decades ago. But nowadays, oncology is now getting, higher. So the category are kind of very different, but I think we now come to join. So you guys are mainly surgical oncology oriented, but I think also you need some years to learn about transplant surgery.
So, just in addition to that question, what age would you recommend any surgeon to start thinking about transplant oncology and go into training?
That maybe end of the residency, so you're going to prepare.
So you should start early, probably.
Yeah.
So to sum up, probably what both these, I would say, both famous doctors in their own right, are stressing on the fact that intestinal transplantation is more easily available. And second, if any young doctors are interested in the field of transplant oncology, you should start early. It's totally different from just being a surgical oncologist or a surgical gastroenterologist, because the field is totally different. And our country has immense potential because of the large proportion of the young population in our country who can probably take up this field. And like you said, baby steps is the name of the game, because you cannot do anything overnight, and just centralization is also very important. So I think I summed up
Yes.
what
Very
you
good.
have said in this short. Okay. Thank you.
Excellent. Thank you. Thank you.